Hello, everybody. Dr. Ryan here. Hope you and your family are well. Thank you for joining me in this, our 84th installment in the OSCE series. We are talking about iron deficiency anemia. If you haven't yet subscribed to my channel, well, what are you waiting for? So this is the typical illness script. A patient comes to you complaining of fatigue, and you note that on the labs, the patient has a low hemoglobin and a low hematocrit, together with a low mean cell volume and a low mean cell vascular hemoglobin, accompanied by a low reticulocyte count. On iron studies, there's a low serum iron level, an increased total iron binding capacity TIBC, and you notice that the iron divided by the TIBC, which is actually the transferrin saturation, is below 20%, accompanied by a low ferritin and a raised soluble transferrin receptor. And so nice combination. Low hemoglobin and hematocrit with a low MCV, low MCHC, low retics, so the patient's not reticking, low serum iron, increased TIBC, transferrin sats below 20%, low ferritin, raised soluble transferrin receptor concentration. What on earth is going on? Well, iron deficiency anemia. So how do we diagnose iron deficiency anemia after iron studies? So what really speaks out loud is a transferrin saturation below 20% and a ferritin which is below 200. Those really shout out loud in terms of iron deficiency. And often you have serum iron which is low. So let me just get my pointer in there. So yeah, often you have a serum iron that is low, a TIBC that is low, ferritin that is low, transferrin sats low. And if you have a soluble transferrin receptor assay, go ahead and use it. And how do we treat? With oral iron replacement, and of course, if the hemoglobin is precipitously low, you can consider a transfusion of packed red cells. And we can't just stop there, everybody. It's incumbent on us as physicians to ascertain what's the reason for iron deficiency anemia. So you determine that with lab testing and further imaging. You might want to consider a pelvic ultrasound for the gynecological pathology, like a fibroid, for instance, upper and lower scopes if you're looking for a GI bleed. The teaching is that a male iron deficiency anemia has bowel cancer until proven otherwise. So this is a beautiful slide taken from the Calorie Guide, just breaking down the pathogenesis and clinical findings behind iron absorption. So as we know that either there's to have a state of iron deficiency, either there's decreased iron absorption, increased iron loss, or there's diminished iron intake, or the need for more iron. And as you can see, these are those etiologies. Lack of iron in the body, especially in the bone marrow, which has the largest reserve for iron in the body, means there's not enough iron to synthesize hemoglobin. Insufficient hemoglobin converts to reduced synthesis of red cells in the marrow, and thence we get hemoglobin, which qualifies as anemia. Okay, so lack of iron can lead to affecting the CNS, which triggers iron-seeking behavior, something we call pica, some people say pica, craving to eat non-nutritive substances like dirt and ice chips. Yeah. Right? Less iron binds to apoferritin to be stored as ferritin, so your serum ferritin drops down low. Right? Increased iron scavenging proteins to scrounge up any available iron gives rise to a high TIBC. Okay. Iron is a cofactor in collagen synthesis, which may explain the blue sclera that we have in some patients. Diminished hemoglobin gives rise to a low MCV, usually less than 80 femtoliters with hyperchromia. The typical smear is microcytic hyperchromic anemia with poikilocytosis and anisocytosis. Because remember, the other things that can also cause microcytic anemia are thalassemia, lead poisoning, sideroblastic anemia, and anemia of chronic disease. You have pallor of the conjunctiva, the palms, the lips, the nail bed. Patient complains of fatigue, exercise intolerance, you have tachycardia, but also long-term you can have cholinicia and angular stomatitis. We're not really sure the underlying pathobiology behind that. My friends, 2 Peter chapter 1 verse 3 says that his divine power, that is God's divine power, has given us everything we need for life and godliness to the knowledge of him who called us by his own glory and excellence. Divine power to overcome sin. God loves you, but God is also holy, and God cannot tolerate sin. And so he has given us his grace by which we can overcome sin and live victorious lives. He has given us everything we could possibly need for life and godliness. Just remain in him. Have a blessed day, and I'll see you soon. Take care. Bye.